Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine. Today our topic is Make America Great. We're going to look at 10 healthcare products we could make it in the US. Yeah, like every country, United States depends upon lots and lots of important healthcare products. We get it from the other countries. That's not, it's not good because we want to make that in America. Especially, I remember going through the COVID; it was a complete mess, right? We didn't have the mask up here, just like any other country. If we were self-sufficient, we didn't have to scramble. We were washing the mask. Have you ever thought in the United States you have to wash your mask and use it during the COVID period? So during COVID, it exposed the healthcare system. So many vulnerabilities. Everybody was up there. I know working in the hospital, we were using the same mask and washing it and putting it on. We didn't have the ventilator. We had to scramble to call so many other hospitals to get the ventilator. It was a complete mess. So we don't want this kind of things happen in the United States because this is number one country in the world and we need to get stronger. So most of the space we think we should make it in our country. So this presentation highlight about 10 products that should produce domestically to protect health and boost the economy. Okay? So the first one, the medication, it costs a lot of money, the medicine, right? Every country and all of that. 90% of the US prescriptions are generic and most of them made abroad. Okay, only 10% of generic medications are made in the US. So most of them coming from China, India, Germany. 80% of the active pharmaceutical ingredients also imported from the other countries. So domestic production is, we need to focus on this domestic production. There should be pharmaceutical companies using the labor over here. We should have enough source, so supply chain keep going to for the quality control. Because when you look at the medicine, the one kind of concern, I think there was a study done. They look at the medicine made in the United States and compared to the medicine the other countries, there's a big difference because some of the ingredients are missing, not effective. I think I remember seeing a thyroid medicine, levothyroxine. If you buy one from here and the outside world, outside the United States, there's a big difference in the effect of it. Okay, so we do whatever up here. We have strict quality control measures. We have everything. Our quality is the best in the world, right? Maybe Japan could be like over there too. But so domestic production of the medicine need to change. Now, the next slide we have is, we just look at this medication versus coming from China around 40%, India 30%, and Japan and Germany. Japan and Germany, I don't know because their quality control process is pretty good. But again, that's not the purpose of this. Not like we should make this medication in the United States. So I hope anybody is watching, the companies, please do make our America great, making some of the medicines right here. Okay. Now, personal protective equipment we call PPE and the medical equipment. Again, COVID-19, everything was a collapse in the United States. I or any of the people who were working in the hospital never ever thought this could have happened. Okay, there was no mask. The mask people were, washing, using the same mask. They were using the mask for like more than a week. And it was nothing available. Most of the hospitals, the same thing with the gloves, and the ventilator was a big issue because I remember there's some people we couldn't put on the ventilator. because there weren't enough ventilators available. There's no BiPAP were available because everything was kind of used up. Our supply chain was stressed so fast, right? And then we had to get it from someplace else. So if you look at 115 billion medical equipment imported in 2023, so 35% of PPEs are manufactured. That's good. Come on, let's make it 100%. Okay, and 25% of the medical instruments are made in the U.S. So again, there's a big market for this. We rely heavily on Germany, China, and Japan, but let's make it in the U.S. Okay. So there's another picture right here, kind of tell us like, China again 50%, India, Germany, and Japan, PPE, the sources, like 50% is coming from China. There again, a lot of things coming from China, okay? Now, PPE and medical equipment, this is where Germany is kind of taking over. Germany and Japan like 20% in Germany, 10% in Japan. China is only around 30%, okay? So European countries are pretty strong in this PPE and medical equipment. I think a lot of ventilators are, made in Germany. They're very good at it. But again, we need to make that, I think right now medical equipment is 25%. We need to make it 100%, but you don't need 100%, at least 80 to 90% for the country to be the great again, okay? So CT and imaging and hospital bed, CT MRI machine, mostly made in Japan, Germany, hospital bed, furniture, local production. 15% of the diagnostic imaging machines, MRI, CTs, are made in the U.S. So approximately 40% of the hospital bed. Okay, now if you look at who got the best technology, who are the brain behind all of that in the United States. Okay, we attract a lot of brain power from many of the countries. So all the smart people, if you ask, they come to this country. We got the technology, but we cannot produce it cheap, right? That's why we're sending it to the other countries, but it's not going to work anymore. So we have to make the production. So 15% of imaging machines are made in the US, even though we discovered the MRI, we didn't discover like CT. Now, hospital bed, this is also kind of concerning. Only 40% is domestically produced. We need what happened right here? It's not that. We need rocket science, and it doesn't. We could produce. We can produce a lot of things up here, cheap and good product. We have to work on it. Okay. The next one, imaging in the hospital bed. We looked at it again. Germany, a lot of imaging thing. Japan, okay. Germany and Japan combine around 60%. China is around 20%. India is 5%. Okay. Now, imaging in the hospital bed. We got a lot of things coming from China, India, and Germany and Japan, and the others around 35%. Okay. Now, dialysis, ventilators. Life-saving dialysis ventilator machines, very, very important. Only 20% of dialysis machines are built in the U.S. Most of it's coming from Germany, Japan, and China. Ventilator, 30%, not good. I personally observed this supply chain. We need to improve, my friends. Anybody who has own companies, who's willing to do, please make this in the United States, okay? Dialysis and the ventilators, we got a slide up here. China 25%, a lot of things coming from Germany and Japan. Now, dialysis ventilator import sources, again, Germany, Japan kind of covered a lot of ventilator. Vaccines and economy. 60% of the US vaccine made domestically. That's good. Okay. One thing I'm looking for, at least about 50% is vaccine. Local vaccine plan, job creation, reduced taste deficit. 60%, let's make it 100%. So, otherwise we depend on Belgium, Switzerland. Next one, we talk about the vaccine. Where are they coming from? Germany, Japan, and China and India. Those are the main countries we import from. Okay. Now, this U.S. healthcare domestic versus imported color-coded, you can see we depends on the other countries to succeed. It's not going to work anymore. Start making in the U.S. Okay, every country want to be the best in the world, right? If you're in any country, every leader is going to say, let's make it in our country. Why not? Why don't we do that in the U.S.? Very, very important. U.S. healthcare. Please, put your any comments. Put it under the comment section. Let's have a discussion. Thank you for watching. God bless. Again, manufacturing healthcare product ensure first safety, and then quality, and it's a make the economic strength. Okay, let's depend. Every country, wanted to do the same thing. So in the United States, we should be doing. We cannot depend on let's make healthcare great again in the. It is great. Everybody come to the United States for healthcare, right? But every small thing we do, we have to depend on somebody, and I don't like it. So let's start making in the U.S. God bless.